Lockdowns are child abuse, I say. More than half of children 8 to 12 reported clinically significant depressive symptoms during the second wave of the pandemic. That number jumps to 70%. 70%. You know what percent of kids have died from the pandemic? Close to zero. Close to zero.
This is one of these things where you theoretically think to yourself, oh, we have to lock down or else we're hurting people. But it's not, that theory has not been proved. In fact, it's been disproved in real world applications worldwide.
New Zealand children falling ill in high numbers due to COVID immunity death. What does that mean? Doctors say children haven't been exposed to a range of bugs due to lockdowns, distancing, and sanitizer, and their immune systems are suffering.
Much of the broad support for lockdowns in the public comes out of a place of fear. And that fear was unfortunately a explicit government policy. SAGE, for instance, I think had a subgroup that explicitly adopted a policy of inducing fear, working with media to induce fear.
The Guardian says in New Zealand, which is one of the worst places in the world in terms of civil liberties, Jacinda Ardern, who was the head of the Socialist International Youth, who's deeply enmeshed with the Chinese Communist Party, just the worst. New Zealand children falling ill in high numbers due to COVID immunity death. What does that mean? Doctors say children haven't been exposed to a range of bugs due to lockdowns, distancing, and sanitizer, and their immune systems are suffering. So they're sick because you're meant to go into the world. You're meant to dig around in the dirt and be on a sports team and rebreathe each other's air and, you know, maybe eat something that's not perfectly sterile. That's how your immune system works. You know, I remember Bill Maher a year ago said we've been in a 1,000,000-year war against viruses. I just sort of heard that and I thought that's true. And, you know, there'll always be another virus, and our immune systems are a wondrous thing. And I bet you the immune system of that 22-year-old Olympian is like the Iron Dome of immune systems. And sorry, he doesn't, yeah, so what do we got here? Epidemiologist and public health Professor Michael Baker used the metaphor of forest brush fires. That's a good one. If a year or two have passed without fire, there is more fuel on the ground to feed the flames. When a fire finally comes, it burns much more fiercely. What we're seeing now is we've accumulated a whole list of susceptible children that have missed out on exposure, so now they're seeing it for the first time. That's exactly right. But can you take me to the Toronto Star article now? It might be paywalled, so we'll just look at what we can see. But the Toronto Star, or maybe Google SickKids, maybe it's available outside the paywall. SickKids, which is a very prestigious, prominent, well-loved, and respected children's hospital in the city of Toronto. It's called SickKids, which is sort of, I always thought that was a little bit of a negative way of looking at it, but I guess that's where you go with SickKids, so it's pretty plain spoken. They've been excellent throughout the pandemic, which means, of course, they've been ignored throughout the pandemic. But if you Google SickKids and depression, they say that half the kids in Toronto, look at this, SickKids releases new research on how the COVID-19 pandemic has impacted child and youth mental and physical health. Can you pump it up for my old eyes? Toronto, while the COVID-19 pandemic has occurred in a series of waves, the heightened levels of depression and anxiety among children and youth seen at the start of the pandemic has remained consistent. This is one of many new preliminary findings from the ongoing COVID-19 mental health study led by the Hospital for Sick Children, otherwise called SickKids. Taken together, the latest findings demonstrate a serious, sustained, negative impact on the mental health of Ontario children, youth, and their families. Scroll down a bit. Loss of in-person school had significant impact on child and youth mental health. Scroll down. School represents more than just academics for children and youth. For many, school and its in-person interactions and activities form the cornerstone of their lives. Yeah, no doubt. Keep scrolling. Mental health impacted by inequities, increased screen time. Exactly. Tips to reduce screen time. Yeah, good idea. How about go back to school? The bottom line, kids need school friends and fun. This isn't some pundit. This is the SickKids experts in Ontario. perhaps the leading children's hospital in Canada. There are great children's hospitals, but I think SickKids probably can claim to be the #1 children's hospital in Canada. So of course they've been ignored. Can you find my tweet on it? Because I actually had some stats. It was like 70% of teens. 70% of teens are depressed. God, I hate what Doug Ford has done. It's like it's child abuse. Can you imagine? Like, it's bad enough to tell grown-ups you can't open your business for a year. Okay, so they're poor and they're depressed, but they're grown-ups. They can maybe handle things because they remember a normal life. Imagine what this has done to children. When I see moms with infants and the moms are wearing masks, all I can think of is you are going to see some trauma in that kid's psychological life for decades to come. Don't worry if you can't find it. You got it. Here, let's take a look. Lockdowns are child abuse, I say. More than half of children 8 to 12 reported clinically significant depressive symptoms during the second wave of the pandemic. That number jumps to 70%. 70%. You know what percent of kids have died from the pandemic? Close to zero. Close to zero. The worst government in the world. The BBC says Toronto is the worst lockdowns in the world. I would go further than that. You know, Dr. Jay Bhattacharya is an expert on these things, but you've never heard of him because he's not a alarmist. He's not on the pay of Big Pharma. Can we play a little clip of him? I think he was on GB News, right? Great Britain News. Let's take a look.
Had normal schooling without masks, without social distancing, and they've had better outcomes for their teachers than other occupations, and very few, and no deaths, I think, or very few deaths among children, fewer than they would expect from just the flu. So I think this is one of these things where you theoretically think to yourself, oh, we have to lock down or else we're hurting people. But it's not, that theory has not been proved. In fact, it's been disproved in real world applications worldwide. And we should heed that lesson.
I'm worried, though, Dr. Bhattacharya, that lockdowns might be used again for COVID, maybe for a particularly bad flu season, because it feels like they've been broadly accepted by the public. Do you share those same concerns?
I am concerned about that, Dan. But I think that much of that concern, much of the broad support for lockdowns in the public comes out of a place of fear. And that fear was unfortunately a explicit government policy. SAGE, for instance, I think had a subgroup that explicitly adopted a policy of inducing fear, working with media to induce fear.
We've spoken about that throughout the show tonight, actually.
It's shocking to me to hear that, actually. That's a violation of a basic principle of public health, that you tell the public the truth. You don't panic them. You do not use panic to control behavior. That is an ethical violation. And actually, it leads in the long run to undermining the trust that people have in public health. So I think that's where we're headed. I think that as the fear dissipates, people will start to say to themselves, was what we did right? And trust in public health may be undermined. But I think, I think we have to work very hard against that. We have to tell people.
Dr. Bhattacharya is excellent, and that channel, as you know, is GB News. GB stands for Great Britain, of course. Very excellent news channel. I have the app, and I'm pushing that channel all the time. You must be saying, Ezra, do you have a stake in it? Are they paying you? No, I just am so grateful for it. It reminds me in some ways of some Sun News Network, in that everyone's trying to kill it off. It's a little low budget compared, it's a startup, so it's not going to be as fancy pants as your Fox News, but it is so refreshing. And they allow conversations like that. And let me say this, I have the app. It's a free app, you can watch it for free. Like, you don't have to pay. There's nothing I think they should probably have some way that people can pay them, because I want to support them. I support other things for $10 a month or whatever. I would absolutely support GB News $10 a month. But it's free. So seriously, download the ad the app rather, GB News. Now you might be saying, well, I'm in Canada, I'm in the United States, I'm somewhere else, I'm not in Great Britain. Why do I want a British news? Okay, half the stuff you're not going to care about. I like the UK. I really got to know it in the last 5 years, so I am interested in local stories. But half their stories, as you can see, are thematically universal. And I mean, I learned something there from Dr. Bhattacharya. Lockdowns are a kind of medicine, right? I prescribe a lockdown to deal with this, but they've never been tested on this scale. When was the last time they had a lockdown? I don't think there's ever been a lockdown in North America. Occasionally there's a riot or a fire, you have like a 1 hour or a 1 day evacuation order, shelter in place order. It's measured in hours, maybe days. But a year-long lockdown, that's a public health experiment that has failed and yet has not been properly discredited. Very interesting to me.
Oh, hi. That was a clip from our Rebel Daily live stream. It's hosted Monday, Wednesday, and Friday by the big boss man, Ezra Levant, and Tuesdays and Thursdays by me, Sheila Gunn-Reid, and my good friend, David Menzies. On the live stream, we talk about the news of the day, we show some videos, and we interact with our viewers at home. We stream at 12 noon Eastern, 10 Mountain. You can find us on YouTube, Rumble, Super U, and Odyssey.